Hello everyone, a very good morning to all of you. So today we are going to talk about biochemistry recalls in NEET MDS 2025 paper. Okay. So a woman affected by autosomal recessive disorder, she marries a normal male, okay, an unaffected non-carrier male, and what are the probability of their child being affected? Okay. So this is a question regarding the pedigree analysis. Okay. So I've talked about a lot of these kind of pedigree analysis in my videos. So let me explain what is autosomal recessive. Okay. So every gene will have a duplicate form. So every gene will have two alleles. Okay. So every gene will have two alleles. So allele is basically a duplicate form of a gene. Okay. These two alleles, one will be inherited from the father, one will be inherited from a mother. Okay. So say for example, in this case, the mother is an autosomal recessive disorder candidate and the father is absolutely normal, right? So in autosomal recessive conditions, when we will say the patient is having autosomal recessive is when only when two alleles, that is both the alleles are affected. Say for example, let us assume this is an affected person and this is a normal person. Okay. So this is one allele, this is one allele, this is one allele, this is one allele. Okay. So when I'm going to say it is an autosomal recessive diseases, only when both the alleles are mutated. So in this case, if you see both the alleles are mutated, and in this case it is absolutely normal. What happens if one of the allele is mutated? Say for example, if the candidate is like this, okay, this case it is going to be a carrier state. It is going to be a carrier or triad. Exactly vice versa in autosomal dominant disorders. So in autosomal dominant disorders, even if one of the allele is mutated, I am going to call that as an autosomal dominant disorder. Okay, so this scenario is going to be regarding autosomal recessive disease. So recessive means, as I said, both the alleles need to be affected so that we can call the candidate as an or the disease as an autosomal recessive. So mother is affected, right? So mother is having autosomal recessive disease. So I'm going to assume mother is autosomal recessive, both the alleles are affected. Okay, father is absolutely normal, right? So the progeny, I'm going to multiply this with this, this with this, and this with this, and this with this. Okay, so the offsprings will be AA, 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 and AA. So now tell me, what is the percentage of the offsprings getting affected? Assuming that this is an autosomal recessive disease. Exactly. So 100% of the offsprings are only carriers or triad, and none of them are affected because only one of the allele is mutated and another allele is absolutely normal in all the offsprings. Okay, so all the four offsprings are going to be carriers and none of them are going to get affected. Okay, so now coming back to the question, the mother is having autosomal recessive disease, which means both the alleles are affected, and the father is completely normal, so he is not having any kind of mutated allele. And what is the probability of the child getting affected? The answer is going to be 0%. Why? Because all the offsprings are going to be just carriers. In case of autosomal dominant disorders, it is exactly the opposite scenario. Even if one of the allele is mutated, I am going to call the patient as autosomal dominant disorder patients. Okay, fine. Now, moving on to the next question. Demyelination of posterior column and lateral spinothalamic tracts, lateral corticospinal tracts in the spinal cord is most commonly caused by. Okay, now, before moving into this question, we should know what is this posterior column and what is this lateral corticospinal tract and what is demyelination. Okay, so see, basically myelin is nothing but it is a protective sheath. Okay, it is a protective sheath covering the neurons. Okay, it covers the neurons. It acts as a insulator. It acts as a shock absorber. It protects the nerves, okay, from any kind of a damage. Now, what is posterior column? Very simple. So you take a look at a spinal cord, okay. So let us assume this is a spinal cord, okay. So in the center you have what is called as the gray matter, and surrounding the gray matter we have what is called as the white matter. Okay, so in the white matter we have what is called as posterior column. Okay, let us assume this is the posterior column. So this posterior column is basically divided into two: fasciculus gracilis and fasciculus cuneatus. What is fasciculus? Fasciculus is nothing but it is a bundle where the nerves, muscles are going to get, packed in. So when I see a packed in feature of a muscle or a fiber, I'm going to call that as a fasciculus. So fasciculus gracilis and fasciculus cuneatus, they are present in the white matter of the spinal cord. Okay, it has nerves, muscle fibers, and what is the main function? It is going to carry, very important thing, it is going to carry the sensory information. It is going to carry the sensory information: touch, proprioception, vibration, 2-point discrimination. All the very important aspects, features are carried out by the posterior column of the spinal cord. Okay. Now, what is this lateral corticospinal tract? Okay. So this lateral corticospinal tract, okay, basically it is one of the very important major descending motor pathway. It controls most of the voluntary movements. Okay, it controls most of the voluntary movements, especially the movement of the limbs, fingers. It is very, very important as it is one of the major descending motor pathway. Okay, now what happens in this scenario is there is going to be damage to the nerve sheath carrying sensory information from the posterior column and the motor information from the corticospinal tracts. So these conditions is majorly caused by multiple sclerosis, vitamin B12, neuromyelitis optica, and acute transverse myelitis. I'll tell you one of the very important features of vitamin B12. Okay, vitamin B12, its synthesis, it is very important for the conversion of amino acid called homocysteine to methionine. Okay, this homocysteine and methionine both are amino acids, and your body needs to have very less amount of homocysteine so that we can prevent the cardiovascular diseases. Okay, so the body will try to keep the homocysteine levels as low as possible. Now, this homocysteine to methionine is converted with the help of an enzyme called methionine synthase. So this methionine, what it does is, it is very, very helpful for the production of what is called as the S-adenosyl methionine. It is very important for the formation of S-adenosyl methionine, SAM. And this S-adenosyl methionine is very, very, very important for the maintenance of the myelin. So the myelin maintenance is a major feature of vitamin B12. This is one such pathway. Another way it helps in the myelin maintenance, that is the myelin sheath maintenance, is it helps in the conversion of what is called as the methyl malonyl CoA. Okay, it helps in the conversion of what is called as the methyl malonyl CoA to succinyl CoA. It helps in the conversion of methyl malonyl CoA to succinyl CoA, Okay. And what happens is, when this succinyl-CoA is formed, this again is converted to methyl-malonyl-CoA with the help of an enzyme called methyl-malonyl-CoA mutase. So this methyl-malonyl-CoA is very, very important, because any deficiency of this methyl-malonyl-CoA is going to result in increased production of methyl malanoic acid, MMA. Methyl malanoic acid. This methyl malanoic acid, if it is in increased state, increased production of methyl malanoic acid because of the deficiency of methyl malonyl CoA, might result in excessive damage to the nerve sheath, especially myelin. Okay, so any deficiency of vitamin B12 will affect the myelin, either by the imbalance in the homocysteine methionine conversion, which results in decreased production of the SAM, that is S-adenosyl methionine. What is adenosyl? Adenosyl is basically adenine plus ribose sugar. Adenine plus ribose sugar. So this adenine is nothing but it is a nitrogenous base. Very simple, right? So N-S-adenosyl methionine, any deficiency, myelin is not maintained properly, damage, demyelination. Again, if the succinyl-CoA is not converted to methyl-malonyl-CoA, increased amount of methyl-malanoic acid, which results in damage to the myelin. So any deficiency of vitamin B12 leads to demyelination, and that in turn is going to result in posterior column or lateral spinothalamic tract disorders, that is going to result in deficit in sensory information as well as the motor information. Okay, so the correct answer is going to be vitamin B12 deficiency. Fine. So now moving on to the next question. Casel's necklace, a photosensitive dermatitis around the neck, is a classical feature of. Okay, so if I'm not wrong, this is an image-based question. Okay, this was an image-based question, and see this patient. Okay, this patient presents with symmetrical hyperpigmented skin lesion. Isn't it? This patient presents with symmetrical hyperpigmented skin lesion, dermatological lesion. Okay, this is what we are going to call it as Casel's necklace, and this is a classical feature of pellagra. What is pellagra? Pellagra is a vitamin B3 or niacin deficiency. Okay, so I'll talk about 4 Ds: dermatitis, dementia, memory loss, diarrhea, death. So dermatitis, deficiency of vitamin B3, niacin, dermatitis leads to Casel's necklace. Dementia, memory loss, diarrhea, GI disturbances, and if untreated, might result in death. So Casel's necklace is very important, and it is a classical feature of pellagra, which is nothing but vitamin B3 or